Energy can neither be created nor destroyed. It can only be transformed from one form to another. This is one of the laws of thermodynamics. And when I think about how that can apply to our bodies, I think about how we use energy. Okay. When you eat, you primarily are taking in energy, a fuel source, and your body has a way of allocating where those energy sources are going to go. If you're active, then 70% of the energy that comes in is going to get stored in your muscle. And then some of that will get stored in your liver, and then some of it will get stored in your fat cells. That is the general allocation. And so what happens when people gain weight? And when I say gain weight, I mean they have more fat cells or more energy allocated to their fat cells than to their muscle or to their liver. What happens, the way I look at it is your fat cells are supposed to be like this cell that has fat in it that's free flowing, right? It flows really naturally. But as you have more fat coming in because it's not being taken by the muscle or by the liver, then it starts to stack itself on top of each other, right? And so you go from having like free fluid of fat to it feeling a little bit muddy, right? If you've ever seen solid fat, it ends up becoming solid. And so if that fat gets muddy and then it gets muddier and you add more pressure to it, aka more fat, it keeps stacking up. And then eventually the fat cell is going to get full and it's going to add more fat to another fat cell, and that process keeps going. It keeps happening, it keeps adding. Eventually, over a period of time, those fat cells are going to solidify. And when they solidify, they turn into tumors. That's cancer. Or sometimes not cancer. It could be a fibroid. It could be a lipoma. But it's basically an accumulation of abnormal cells. In this case, I'm explaining fat cells that stack up on top of each other over a period of time. And because of that pressure, it's going to create a solid tumor. And a lot of times we're not going to feel the symptoms of this, right? Usually we find out something has happened when we go to a doctor and they're like, oh, there's a red value on your blood work, right? Or you have a tumor or something. But while that is building, we usually don't pay attention to it. And so I call this type of fat that is just consistently accumulating over time, I call it resistant fat. Because fat is normal and it's good for you. We need fat as a reserve, but too much of it over a period of time is going to cause resistant fat. And resistant fat in your brain causes mental illness of different forms. In your body, it causes tumors and so many different things that it just wreaks havoc on you. And so I created this program called Shed Resistant Fat, where I teach you how to remove these blocks that have been created so that your fat cells can be free fluid, right? That it can remove all the things that you have added onto it. And a lot of times, most of the time when we're talking about fat, everybody talks about food. And that's just the downstream effect of it. A lot of times it has to do with what's happening in your mind. And so the only way to shed resistant fat is to shed resistant fat from your mind and from your body. And that's what I teach you in my program. So if it's something that you're interested in, it's in my bio. But remember, fat cells are only supposed to be free fluid. They're supposed to flow. There shouldn't be a muddy fat cell. There shouldn't be a solid fat cell in your body. And so the goal is to make sure that your muscles are active so they can take 70% of the energy that's coming in. And then obviously you want your liver to be working properly so it can take the amount of energy that it needs to reserve. And then your fat cells can have the rest of it. But if the order is not correct, you're going to have resistant fat, and that is going to lead to disease.